Good morning, everyone. My name is Maya Luria with TMC for Seniors, and we are we're doing Heart Month all this month. And today I have Greg Koshkarian here from Pima Heart and Vascular. He is a cardiologist. He actually graduated from Yale University, and he did some incredible fellowships, actually. In heart failure and general and interventional cardiology. He's board certified in internal medicine, cardiology, and interventional cardiology. So I want to welcome you here today, Greg. We're so thrilled to have you.
Well, thank you very much, Maya. That was a kind introduction. I'm happy to be speaking to the TMC seniors today. It'd be nice to see everybody in person, but we'll make do with this webcast in the meantime. But hopefully, I'll be able to do this in person once it's safer. So I conceived of this lecture on cardiac prevention as a contrast to what patients are usually told, which is take this medicine, take that medicine, do this study, do that procedure. Think of cardiac prevention as your opportunity to take control of things yourself. So we're going to be focusing on exercise and diet, two things that you have full control over. We're going to start with exercise first. We're going to discuss why exercise is good for you. Can it actually be bad for you? How to determine the right amount of exercise, what type of exercise is good. So why is exercise good? Well, it leads to cardiovascular fitness. So people who exercise regularly will tend to have lower heart rates. They will tend to have lower blood pressures because their blood vessels dilate more easily, and that leads to less work for the heart. There are musculoskeletal effects, and in fact, I actually want to stress that the purpose of exercise is to exercise your body, not to exercise your heart. Your heart is exercising all the time. It pumps on average 80, 90, 100,000 times a day. So extra pumping doesn't make it in better shape. What is making the heart in better shape is that the body gets in better shape. The muscles develop more enzymes to utilize oxygen better. The blood vessels in the muscles dilate more easily. And these are things that will then have long-lasting effects after the exercise and make it easier for the heart to do what it needs to do. Now, the other thing that exercise does is it benefits risk factors for heart disease. So, for instance, people who exercise regularly tend to have better controlled blood pressure. Their lipids are better. In particular, triglycerides tend to go down when you exercise regularly. Those of you who have diabetes will find it easier to control your sugars. Exercise builds lean body mass, and that's good for diabetes. And it's good for your weight. And I want to say a little something about weight. So I did not include weight in this lecture for a couple reasons. One is that weight, while is somewhat in our control, lots of people diet and they do things and their weight doesn't change as much as it should, and they get frustrated. And so weight isn't something we have quite as much control over as we do choosing what we eat and choosing how much we exercise. And the other thing is that a lot of the studies on the risks of being overweight, when they look at why being overweight causes heart problems, it turns out that a lot of it is related to the reasons people are overweight, meaning they don't eat the right things and they don't exercise. So if you do those two things, then the weight becomes less of a problem. If your weight goes down, great. If your weight doesn't go down, you're still benefiting yourself immensely by doing exercise and eating a healthy diet. All right, so we talked about what's good about exercise. Can exercise be bad? According to this portly gentleman, it can be bad, and he describes all the things that you would experience with exercise. Your skin gets flushed, your heart goes fast, you get sweaty, you get out of breath, and his conclusion, very dangerous. So the dangers of exercise. Yes, when you exercise, your heart rate goes up. At that moment, your heart is working harder, and that does put a transient risk to you. Your blood pressure goes up, so your heart is working harder in that way too, pumping against an increased pressure. And the heart is working harder directly because adrenaline levels go up, and so your heart is being stimulated more. So these are all things that make your heart work harder. And during exercise, there is a transient increase in the risk. And then we always hear about these scary things that happen to elite athletes who one would think would be invincible against any heart problems, and yet some of them die suddenly and very sadly. One of the things you have to keep in mind is a lot of these people who die suddenly have a genetic cause, something that they didn't realize they had, a cardiomyopathy. So the exercise was the trigger to dying suddenly, but they already had a condition that unfortunately wasn't realized until it was too late. But there is also evidence that you can exercise too much, that beyond a certain point, excessive exercise, excessive intensity of exercise can actually lead to little tiny scars in the heart to put you at greater risk. So, people who exercise for a living, meaning athletes, they are trying to train themselves to be very competitive, and their goal is to do more than just exercise. And so when we're talking about exercise for the average person, that kind of intensity isn't something we're necessarily shooting for. And here's a general little warning for couch potatoes. If you haven't exercised at all, you should be careful about embarking on a vigorous exercise program before speaking to your physician. Keep in mind that the remote control for your TV and the handle for your recliner do not qualify as having exercised. So here's the paradox. We talk about a transient increased risk, but then an overall lowering of your cardiovascular risk if you exercise. So we're going to do a little math here. Don't be intimidated. This is pretty straightforward math, but a few numbers is illustrative. So let's take the average 70-year-old person. Their average daily risk of having a heart attack is, say, 1 in 5,000. And if we divide the day into 24 hours, that comes out to 1 in 120,000 risk per hour. So let's say during the hour you exercise, your risk doubles of having a heart attack. So that sounds pretty scary, but that's probably a realistic thing. So now your risk is 1 in 60,000. However, the rest of the day, because you have trained your muscles to accept blood more easily and the heart is not having to work as hard for those other 23 hours, the rest of the day it drops by 33%. So doing a little bit more math, we take that 1 hour where your risk of having a heart attack goes up to 1 in 60,000, but the rest of the day, it's 1 in 180,000 each of those hours. We do a little multiplication. We come out with 26 in 180,000 risk, and that averages out about to a 1 in 7,000 risk per day. And if you remember, originally I said the average person's risk is 1 in 5,000. So now your risk has gone down by 28% by exercising regularly, even though your risk doubled during the time that you're exercising. So that's how that paradox kind of squares off, is that there's enough of a benefit during the time that you're relaxing and sort of achieving the benefits of the exercise that it more than makes up for the transient increased risk. So how do we beat the paradox? We minimize the risk, we maximize the benefit. We choose a middle ground, which is moderate exercise. So not necessarily the intense exercise that athletes do, and not mild activity that is just walking around the house or taking a casual stroll, but a moderate level of exercise. So what is moderate exercise? It's exercising to 60 to 80% of your maximal predicted heart rate. That for a 70-year-old would be about a 90 to 120 beats per minute heart rate. 220 minus your age would be a maximum of 150, and that's where we get 90 to 120 is 60, 80% of that. But I always tell my patients not to focus on their heart rate for several reasons. One is not all forms of exercise lend themselves to checking your heart rate. So, you're jogging along and it's not easy to take your pulse while you're doing that. Yes, lots of us have Fitbits and Apple Watches and things like that, but they're also not always 100% accurate. The other thing is that a lot of people are on medicines that lower their heart rate. And so if you're on a beta blocker or a calcium channel blocker, you're not going to see the same increase in your heart rate that you would if you weren't on those medicines. And as I said earlier, it's not your heart you're exercising, it is your body. So looking at your heart rate is what we call a surrogate marker of exercise. It's not that the goal is to get your heart rate to a certain level. The goal is to get your body exercising to a certain level. And so if your heart rate doesn't go up as much as another person's, but you're doing moderate exercise, that is what our goal is. So I usually focus on a subjective measurement of how you're breathing. So your breathing rate increases, but you're not gasping for air. It's something that you can maintain for 30 or 40 minutes without feeling like you're totally exhausted. If this person is in the room with you, you could converse with them, but you wouldn't be able to speak as quickly and fluently as I am right now. So if I were exercising, I would have paused several times in this conversation. One of the things we say is you can talk, but you can't sing. And it's good to have a little perspiration. That's a sign of a moderate level of exercise. And our goal for duration is about 150 minutes a week, broken up into 4 to 5 days. So 30 to 40 minute increments. So that is the goal for moderate exercise. Now, it's important to listen to your body. If you are or were a couch potato, before you do something that's fairly vigorous, you should consider seeing your doctor. That way that he or she can screen you for symptoms that you might not have been worried about, might even suggest doing a stress test with a cardiologist before clearing you for exercise. The other thing is to pay attention to symptoms. So as I said, it's normal to become more short of breath. In fact, it's necessary to become a little short of breath. I'll mention parenthetically that when my patients come in and they tell me, oh, yes, I exercise regularly, I walk regularly, and I kind of trick them and I say, well, do you get it all out of breath when you're doing that? And they said, oh, no, I have no problem breathing at all when I'm doing that. And I say, well, then you're not exercising. But back to what things you should worry about. You should not have chest pain or pressure with exercise. You shouldn't be getting lightheaded when you exercise. Palpitations are normal in the sense that, yes, your heart rate goes up and you can feel that. But if you are exercising at a certain level and suddenly your heart rate jumps up much faster, that would be a warning sign. Also, again, a little perspiration is normal, but if you suddenly break into a profuse sweat and feel poorly in other ways, that should be a warning that you should stop what you're doing and reassess. And finally, suddenly becoming pale is something that could be concerning. So these are all things to pay attention to so that you can exercise safely. So what kind of exercises are good? People ask me, what's the best form of exercise? And I've listed some of the things here that are good moderate levels of exercise: an elliptical trainer, bike riding, swimming, water aerobics. Dancing is a great form of exercise. Tennis, and I put doubles because if you play singles, that often pushes you into a more intense level of activity. Brisk walking, walking in a hilly area, light jogging, these are all moderate levels of exercise. You can use a pedometer. If it's hard for you to do any of these things for arthritis reasons, try to log 10,000 steps a day. But the important thing, again, when people ask me is, what should I be doing? Do what you enjoy. Because if you don't enjoy it, you're going to do something for a couple days and then give up on it. People sometimes buy these fancy exercise machines. They either can't figure them out or it just bores them to do it. So think about something that you can do day in and day out. And finally, some more safety tips. Avoid abrupt changes in intensity. You should have a warm-up period where you gradually are achieving your moderate level of exercise. And then at the end of exercise, don't just suddenly stop. Cool down, walk slowly. And that's also, a way of avoiding your blood pressure dropping. Avoid temperature extremes. Certainly in Tucson, Summer exercise can be daunting, so you have to get up early in the morning when it's relatively cool to do your exercise, or exercise indoors when where you've got some air conditioning, and in the wintertime later on. The other thing is consider the effects of competition. So for any given level of exercise, let's say you're jogging, if you do it with another person, there is a certain level of competitive spirit that gets into it, and your adrenaline levels will go up, and that can push you into a higher level of intensity. So just keep that in mind. So that sort of summarizes my thoughts on exercise, and I'm going to turn to dealing with diet. I'll tell you up front, I'm not a dietitian. These slides are meant as general principles. There's lots of information on the internet to get more specific diets, but again, I just want to speak in generalities here. So I'm going to focus on the food groups. So with protein, one of the best things you can eat with protein is fish. Try to eat at least 2 helpings of fish a week. Lean meats are good. Chicken, particularly the white meat of chicken, white meat of turkey. Pork is okay if, again, it's the lighter cuts like pork loin. Eggs, there is conflicting data. Sometimes we hear they're good. Sometimes we hear they're bad. I think it's reasonable to eat an egg a day. Definitely the white part of the egg has a lot of protein in it, the albumin, and that's safe. So a lot of people who do like eggs will get rid of the yolk and just eat the white part. Excuse me. Other sources of protein: beans and lentils, tofu, and nuts and seeds. Turning to other categories, fat, we want to stay away from saturated or trans fats and look for polyunsaturated fats and monounsaturated fats. Avoid animal, and I mean mammal fat. The skin of chicken is something that should be removed. Obviously, red meats have a lot of fat in it. Butter is pretty much pure animal fat. So look toward the healthy oils like olive oil, safflower oil, sunflower oil, grapeseed, flaxseed, soybean, corn. These are all healthy oils that you can use to cook with or add to foods. Carbohydrates should be unprocessed. When you process carbohydrates, you strip off the healthy stuff and you're left with just the things that turn quickly into sugar. The mantra that we tell people is brown, not white. So whole wheat pasta, multigrain bread, brown rice, avoid white potatoes. So sweet potatoes are actually much healthier than your usual sort of white potatoes. And a specific example of a healthy diet is the so-called Mediterranean diet. It's heavy in fish, uses olive oil, lots of legumes like beans and peas and chickpeas and lentils, nuts, and I won't list all those nuts, but those are kind of the top healthiest nuts there. Lots of fruits and vegetables, be generous with those. Unprocessed cereals and grains. And a word about supplements. I have to admit, I am not a big proponent of supplements. My belief is that nature provides nutrition in packets, and those packets are in food. And so you should eat healthy food and not extracted molecules from those foods. Yes, there may be some supplements that are good for you, but the issue is that supplements don't require any FDA testing. They don't require any large trials to prove that they're beneficial. So it's very hard for me to tout any particular supplement as proven beneficial. Get your health from the foods. So in summary, for exercise, aim for 150 minutes a week over 4 to 5 days. Shoot for a moderate intensity, and choose something that you like that you will continue to do. Listen to your body, pay attention to symptoms that might be warning signs. And when it comes to diet, eat healthy types of proteins and fats, and with carbs, stick with brown, not white. So thank you very much for your attention, and I hope you've learned a few things from this.
Thank you so much, Greg. So I do have a couple of questions for you that have come in. One about the supplements. So obviously you don't agree that supplements would prevent heart disease from the sounds of it. We had a question asking about supplements. But is there anything about green tea that helps to maybe help with your cholesterol, or garlic that would aid in treating your blood pressure?
Mhm. So
Any
those
of
are,
that?
yeah, and I have to say that that it isn't that I think supplements are necessarily bad. It's just that it's hard to definitively say, oh yes, this has been proven effective. I think there are components of green tea that are quite healthy for people, and it has antioxidants in it that are likely to be beneficial. There's certainly some studies that show that garlic may be helpful, but again, they're small, generally uncontrolled studies. I like garlic, but I like garlic because I put it in food and it tastes good. So again, I would tend to use garlic that way and not get some extracted garlic supplement.
Okay, great. Yeah, so get it from your food is
Hmm.
definitely what I'm hearing.
Yes.
Okay, so I've got a couple questions that came in asking one about family history. If somebody has a family history, that are they also at risk, and that they're having difficulty shedding the weight. So it sounds like they're trying right now, but
Yeah.
haven't
Yes.
had success.
Okay. So in terms of family history, um, someday there will probably be tests that will be able to look at particular genes. In fact, there's already these things out there, but there'll probably be much bigger panels where you won't have to guess about your family history by asking about your parents and your siblings. You'll just know what your genes you have and what you're predisposed to. But for a cardiologist and for physicians in general, what we consider to be a strong family history is if you've had a first degree relative who has premature heart disease. So, what's premature? Men before the age of 55, women before the age of 65. Women get heart disease just as much as men. It just tends to be a little bit more delayed in time. So if your dad had a heart attack at the age of 50, or your mom had an angioplasty at the age of 60, that would be considered to be something that puts you at higher risk. The reason we don't worry about it so much as people get older is because heart disease is so prevalent in this country that, in a sense, everybody's bound to get it to some extent, by the time they're 80. And therefore, if your mom or dad had a heart attack at the age of 80, it's just a lot less likely to have a genetic component. In regards to weight, I wish I had some easy solution. It's very hard to lose weight, very hard to keep weight off. There's a lot of fad diets. I'm not going to tout anything in particular. Again, speaking in generalities, I think our diets have too many carbs in them. So cutting down on carbohydrates, and a lot of the diets that out there look to do that, is one of the best ways. Think about particular sources of calories that you're aware of. So for instance, if you drink beer's got a lot of calories in it, both in the sort of hops, barley and hops and things like that, but also the alcohol. Cut down on that. If you like sodas, cut those out. Some people are potato chip eaters. So if you're snacking between meals, um, those are some general ideas. But I tend not to push fad diets because they're hard to maintain. They're not necessarily healthy diets. So once you are able to cut down on your weight, I recommend try to maintain it with a healthier long-term diet like a Mediterranean diet.
Makes sense. Okay. What about, can you reverse heart disease with exercise? So if you already have heart disease, are you able to reverse that?
Mhm. So the short answer is yes, but it is very hard to reverse things. And I will tell you that if you can stabilize it, that's a really good thing in and of itself. People often ask, how do you make this plaque go away? And my answer is it's hard to make plaque go away, but if you do things that actually just stabilize it, that's the most important thing, because heart disease manifests itself as events, attacks, strokes, things like that. And so if you can keep plaque from building up and from becoming unstable, that's a good thing. We can't know what's going to happen to every plaque in our body. So when they do studies on like medicines, blood pressure medicines, cholesterol medicines, to see does it quote reverse heart disease, and they do an angiogram and they look at different plaques, what you will find is that, let's say you have 100 plaques somewhere in your arteries, you might find that 5 of them reverse, 50 of them stabilize, and 45 of them progress over the span of 5 years. And so we want to shift to stabilization and reversal. And so, again, the short answer is exercise can be helpful for that, but exercise is more likely to be a stabilizing factor rather than a reversal factor.
Okay. And what about, so I've had quite a few questions come in, so it's fabulous. I had another question come in asking sort of about exertion when they're working out. So looks like they were riding a bike, they were going uphill for a short time, and her wearable told her that it was much higher than she had ever experienced before. She said it was a short burst and not extended, and she felt okay, but just breathing heavily. She just wants to know, is that type of brief exertion okay? Is that type bad for us, or is that okay?
So my guess is that during that transient time when she was riding uphill, she probably was now not doing moderate exercise, but intense, high level of exercise. And it's not the case that a person can never do that or never enter that. But there's a little more risk during that time compared to the moderate exercise. I would say that if she is going to be doing something where she regularly does feel that kind of sensation, she might want to talk to her doctor first, see if it's recommended that she have a stress test. But I would not automatically say don't ever do anything that gets your heart rate up above the moderate range. It's not that that's a sudden danger zone.
Okay. And so I've got another question that came in about are there specific areas that perimenopausal or menopausal women should be thinking about?
Only to the extent that, when I said that women tend to develop this disease 10 years later than men, that is likely due to the protection of hormones that are occurring before menopause. So if you're menopausal or perimenopausal, just consider that you are now entering the stage of your life where you are now at higher risk of having heart disease, and concentrate more on, okay, what can I do to be healthy? Whoever asked that question has just listened to this lecture, and those are the things you can do.
Excellent. And are you prone to high cholesterol? If you're prone to high cholesterol, and I know that runs in many people's families, what can you do? And would you consider taking on a plant-based diet if that was the case, or?
So probably a plant-based diet is the best diet to lower your cholesterol level. Depending on what your risk is, and your risk is, and actually I'll take a step back and tell people that most people's cholesterol is higher than is healthy in this country. An absolutely normal LDL cholesterol is only 50 or 60. That's what we're born with. So even so-called good cholesterols where you check it and it's 80 or 90, that is actually high enough to form plaque in your arteries. So because we now believe everybody's cholesterol is too high, we no longer treat cholesterol because the cholesterol is high. We treat cholesterol because the risk is high. So a person who has a tendency to high cholesterol, kind of like anybody else, should be assessing what is their underlying cardiovascular risk. And there are things online you can do to answer that question. It's called the Framingham Risk Score. Or you can talk to your doctor. There's apps that they may have that can calculate your risk. And so the answer to this person's question is potentially she or he may need to be on a medication, but we usually make that determination based on what the person's underlying risk is. And I'll add that I consider diet and medication to be complementary. It's not an either or kind of thing. If you can get your cholesterol down by 20 or 30% with diet, and then another 40 or 50% with a medication, all the better.
Excellent. Okay. One last question that came in. Okay. You're going to love this. What do you think about baked potato chips as opposed to regular?
Okay, so I've never been asked that, but I'm gonna shoot from the hip here. Baked is better than regular because there's not as much oil, but it's still potato chips, and potato chips are not the healthiest form of getting your carbohydrates.
But maybe if you like a little snack, maybe that, I don't know,
maybe
coming on tomorrow, we can ask that then too. So
yes, or baked sweet potato chips.
That would be excellent. I love that idea. So I wanted to ask you, what about, can you tell us the locations that you see patients in?
Oh,
I know
sure.
you have a couple of different locations, and I'm also going to put up your phone number for anyone who might be interested in an appointment.
Yeah, so I see people mostly out of Oro Valley in the medical office building next to the hospital, and at Northwest on our office on Orange Grove and La Cañada. And then I also have a clinic that I go to out in Rita Ranch off of Rita Road. It's a TMC1 office if people are familiar with that.
Excellent. And
Yeah,
the appointment, if somebody is interested in making an appointment, they would call 838-3540. I've got the number up on the screen there for you.
thanks.
This was great information. I love this. I enjoy hearing you speak about exercise and diet and how important it is. I know we have all these different aspects for our heart health, and these are two really important things. So I really appreciate that. I did have, and you are a general
I'm a
cardiologist.
general cardiologist. So you mentioned that I interventional trained, and that is true, but I gave that up a few years ago for health reasons, which I won't go into. But no, right now I just do general cardiology.
Excellent.
I
Thank
also
you.
should mention, and because a lot of these questions touch on things other than the topic, I actually have a website where I do blogs, and it touches on risk factors for heart disease and a lot of other things, and it's very easy to remember. It's gregkoshkarianmd.com. So if people are interested in looking at some articles on some of these topics, that's another place to go to.
Oh, perfect. Thank you so much. So that was gregkoshkarianmd.com.
Yeah.
So yeah, I appreciate that. Thank you for sharing that. So thank you so
Actually,
much.
I think it's actually Gregory Koshkarian, MD. I'm reading my name here off the scroll here, but it's actually GregoryKoshkarianMD.com.
Oh, Gregory
Yeah.
Koshkarian, .com. Okay. I didn't have that up, so I apologize.
No, that's okay. I just thought of it.
All right. Well, thank you so much for being here, and we look forward to having you back in the future.
Thanks very much.
We will be back online tomorrow, so I hope to see or get to share with everybody again. We'll be doing heart healthy meals and snacks with Mary Milady from our TMC Wellness. So I hope you'll be able to join us then, and that'll be at 10 a.m. again on our Facebook and YouTube pages. Thank you all for being here.